right, listen to this. Dallas County right here ranks number 5 for new cases in the country for COVID-19, according to Johns Hopkins University. That's something we are not proud of. Dr. David Winter from Baylor Scott and White Health joins us with the very latest. Good morning to you, Dr. Winter.
Good morning.
How does that make you feel to know that we are top 5 in the country?
Yeah, it's not a good title to have. You talked about number 5 in number of cases. Also from our morning report at Baylor Scott and White Health this morning, we're also going up with number of hospitalized cases. These are the sickest of the sick folks. And I must say, I'm not surprised. When I look around at restaurants, grocery stores, parks, people are not distancing, they're not wearing masks. I'm not surprised. This virus is out there. It's very contagious. It's never gone away, and it's coming back right now. Now, I think we can open up, go back to work, get out in restaurants, but we have to distance, and we have to wear masks, and we have to wash our hands. We have to respect this virus because it does not respect us.
Now, would you say that we're going to see a second surge of COVID-19? Is that what we're seeing right now?
I think we are, and this one will die down when we do the right things, and it'll come back again if we don't pay attention to it. We've got to have a vaccine or some medications that work. Right now we don't have that, and so all we're left with the fact that this virus's whole goal in life is to spread, and if it quits spreading, it dies. So that's its one talent, I've said before, and it's going to keep doing that, so we have to respect that. It's an equal opportunity invader. So we need to distance ourselves, wash our hands, and be very, very careful.
We're talking about distancing ourselves. We've been discussing that for months, but in the last week or so, with a massive amount of crowds coming out to protest, would you predict that we're going to see even more cases in the next week, maybe even 2 weeks, as a result of those protests?
Indeed, that's another place where it bothers me quite a bit. People can get out and protest, but they've got to wear a mask and they need to separate themselves. I didn't see anybody washing their hands or disinfecting, but it's not just there, it's everywhere where people get together. It's not just in the protests. It seems like as we open up, people have this viral fatigue. I'm sick of being quarantined from this virus. Well, the virus doesn't care about that. So you need to respect this virus or it's going to spread even more. Now, the good news I'll tell you is that we're getting better treating this. So it's interesting, early March, the death rate of people who were very sick with COVID virus has gone down 40%. 2 possible reasons for that. One, this virus has been mutating, and sometimes viruses mutate to where they're less lethal to us.
Interesting. We
haven't found evidence of that yet. I hope that that happens. But we do know that doctors are getting much, much better of caring for patients. Doctors and nurses, the entire healthcare community, learn how to use ventilators better, learning how to use medication to prevent that cytokine storm that goes on, learning how to use these antivirals to some degree. So we're getting better about taking care of patients, but still too many folks are getting it, and too many folks are going to come down with it in the future if we don't take care and distance and wash our hands and wear masks. That's the big message.
Now, I want to make sure I understand this correctly. So you're suggesting that the virus might be mutating, but we're also learning how to better take care of our patients. And so it's just not giving us a break here.
It's not. This type of virus, it tends to mutate. It's interesting we say mutation. What does that mean? It actually means that the virus makes the mistake. The virus' whole goal is to replicate, reproduce itself in somebody else's cells. And when it makes a mistake, sometimes that mistake is deadly for the virus, then it goes away. Sometimes it makes the virus weaker. Sometimes it get more lethal. There's been about 21 different mutations so far we know about, and we haven't seen a big change yet with that. We know very well when patients go in the hospital, though, we're taking better care of them. Our physicians and nurses and healthcare workers and the scientists are learning better ways with this new virus we've never seen before to take care of it. So I'm very proud of our healthcare system. They need our accolades for that because it's tough. I've been in our ICUs, and it's sad to see people walking around in spacesuits and the patients scared and breathing hard, but they're getting out sooner and they're getting out quicker because of the things we're doing in the hospitals right now.
Yeah, it's just so scary to know, and we know the reality of this. We definitely know the reality of the virus. You say respect the virus, but I can't help but think that this virus has a mind of its own. We also want to encourage you to text your questions to us. It's 214-977-6028. While we have Dr. Winter here with us, and we have a viewer question. Dr. Winter, is a throat swab COVID-19 test as effective as the nasal swab? What's the difference in the two?
That's a good point. What we're trying to do is we're trying to get on the swab the virus. So we try to figure out where is it most likely to be, and in most folks it's in the nose, but some folks have very little nasal symptoms and are very, very sore throat. So we'll pick it.
You know, earlier you mentioned that we're getting better at treating our patients if they're in the hospital and if they are positive, but some reports suggest that the fatality rate is going down. Is that true?
It may be 6 months, a year, could be longer, but we're going to find a way to get this virus. We've got some good scientists working on it right now.
And we have a lot of faith in you. We have another question from a viewer here. What are some of the medications that have been found successful in helping with the inflammation storm?
They're anti-inflammatory medications. So
Now, Dr. Winter, we only have about a minute left. I'm going to try and squeeze in 2 questions, okay? This is something that I've also observed, and I heard you say you've seen this also. Do you think people are associating the state reopening with a more lax approach to the pandemic? And can you give us maybe an idea of a timeline when you would predict that COVID-19 is no longer a threat?
Well, that last one's a tough one. Let me start with the first one. You know, we can't just stay in our houses forever. We can't quarantine forever. We need to find the right way to get back out there, and we're not doing that right now. Although, let me quickly say, some folks are doing it correctly. We need to learn from that. And I think the folks that are getting sick right now will understand maybe they didn't do things quite right. Some were just unlucky, but most folks that are coming down with this didn't distance right, didn't wear a mask when they should have, didn't clean their hands as much as they should do that. If we learn how to do that, we will actually protect ourselves. Now, we're dependent upon science to find a way to treat this virus. It's not going to go away on its own. It's extremely successful in spreading. And importantly, it doesn't kill most people. That means it'll get in your body and you'll spread it to 2 or 3 other people before you kill it yourself. Our bodies can kill the virus, but while it's in your body, it's spreading. That's its whole modus operandi. Now, how soon? I'd love to think it'd be in 6 months, 12 months, but stay tuned. That's anybody's guess right now.
You know, we sure do appreciate your expertise, your insights, and for giving us all this wonderful information on Good Morning Texas today. So please have a great weekend, stay safe, and we'll see you soon.